Hi, my name is Karina Zilman. I am an associated professor at Federal University of São Paulo, Brazil, and as a psychologist, psychoanalyst, and public health PhD, I am here today to unveil the underlying logic to health care for HTLV-1, and as well to state that there is a paradigm that interferes in coping actions to its eradication worldwide. Faced with a still incurable infection discovered for so long for Dr. Gallo and his team, it's logical to argue that prevention should be taken as a fundamental action in public health. However, screening initiatives to identify people living with HTLV and campaigns are almost inexistent, so it has become unreasonable to question why. You probably know my work, such as in 2012, I and my colleagues, Dr. George Kaseb and Professor Augusta Alvarenga, had stated that HLV is a neglected infection and a public health problem in a very important journal, the PLOS Neglected Tropical Diseases. In aim to bring more elements to corroborate with this proposal to eradicate HTLV-1, this article, that was the result of my PhD thesis in public health at the most prestigious University of Brazil, the Public Health Faculty of the University of São Paulo, this article highlighted the lack of effective coping actions in the world, making HTLV a worldwide serious threat and neglected public health problem. Since then, HTLV researchers community has accepted this argument as a logic and reasonable reference to understand this endemic infection. What you haven't understand is that my argue has had more complexity than you have realized, and I'm here today to clarify this point of view. In my PhD thesis, we propose a reflection that can contribute to unveiling an underlying logic, which is, although public health discourses emphasizes the importance of prevention, health policies are still based in a biomedical conception focus, fundamentally centered on the illness. The need to deal with a deadly disease is the most convincing argument used to demand financial support, for example. We are able to see this type of argument when such important researcher as Dr. Gallo and his colleagues emphasize that HLV can cause cancer. We already know that our HLV can cause cancer, and we know it for a long time. But why to emphasize it, and why to emphasize it now? The message is everybody fears the big C, so it's urgent to invest to deal with a deadly threat. Its logic, this logic is so important that it has been claimed to change the name of HLV infection to its original name, which was human T-cell leukemia virus, HTLV. It's well known that symptomatic HLV positive patients demand biomedical care and control of symptoms, and it's very important to do so. But the majority of people living with HLV are and will be asymptomatic for their entire life, although they may transmit the virus to sexual partners and offspring. Therefore, the majority of people living with HLV present non-medical needs, such as psychosocial demands and counseling about their family relations, reproductive decisions, emotional and social consequences, as for example, the breastfeed interruption. Another consequence of this underlying logic is that Current public policies focus it only or fundamentally on illness is that care becomes centered on medical or biomedical knowledge. And for this reason, health teams end up unprepared to deal with the complex demands of people living with HTLV. In a biomedical point of view, it's urgent to invest in laboratory researches. Those researchers are expensive and extremely important. We agree. This argue is valued as well. But there is a public health point of view that needs to be taken in action, the need to invest in prevention. Prevention may be cheaper than other types of laboratory researches, but it's not for free. Prevention demands a forceful point of view that relies on the identification of people living with HTLV-1 and invest in a comprehensive care of their unique needs. There are many colleagues in our field in Brazil that argues that multi-professional care demanded for people living with HTLV-1 are too sophisticated, especially considering the developed countries' situation. In this point of view, and public health policies, if public health policies invest to identify these people, it would be a problem as we would create a type of care demand beyond medical care, and that health services would not be prepared to deal with. This argue is valid too, but is it fair to those living with HLV-1? Considering that HLV-1 still is an incurable infection, prevention should be the primary way to deal with it. If you consider HLV an infection unimportant because it doesn't cause deadly disease, we would establish that it's not important. So there's no need to create an alert about this infection, especially considering that this is no cure or vaccine to offer. We have again a biomedical logical point of view. Thus, a vicious circle is established. Ignorance about HLV-1 virus among professional or lay people leads to non-recognition of the need to identify this infection in our society. On the other hand, prevention actions are not structured, leading to the non-identification of the real dimension of this infection in society. In fact, we know there is little epidemiological data available. Finally, the most important consequence is that HELV1 perpetuates itself in our society and remains invisible from the point of view of public health actions. Oh, and the issues of invisibility, the issue of invisibility. For this, we need to demand psychosocial and psychoanalytical knowledge articulated to the contemporary public health expertise. Well, it's another complex of reflection that needs to be addressed, but it's going to be a discussion for another opportunity. The HLV endemic leads us to articulate different fields of knowledge. So it's possible to see that HTLV is a paradigmatic case from the epistemological point of view. In other words, this type of endemic demands a new paradigm of care as well. Thus, from the perspective of comprehensive care, it's considered the need to advance interdisciplinary and interprofessional work in public health to cover complex needs, as well as giving visibility to the real dimension of the singular infection. Hope to have instigated you to reflect, and I would like to make myself available to help whenever necessary. All the best for you. Hope to see you soon. Affectionately, and bye.